Achilles tendonitis is something that happens to a ton of people for a myriad of reasons, whether we have tight calf muscles, tight hamstrings, tight soleus muscles, loss of range of motion at the ankle joint. We've been overworking our legs in terms of sports play, walking up and down steps, up and down ladders, things like that. Anything that will increase the stress load on the actual Achilles. If we're weightlifting and we hadn't been weightlifting before, those types of scenarios. So depending on what environment you're in, will kind of determine which scenario is probably more applicable to you. So if you're a sports person or an active person just in general, whether it's trail running, whether it's like calisthenics and aerobics and HIIT programs and things like that, or you just now got back into the gym, or whether you've been a lifelong runner or any type of basketball player, any type of athlete, generally you're going to have an overuse type of injury going on. If you are not in that category, and if you're more sedentary, you just may have a generalized tightness of the musculature around the Achilles, which then puts additional pressure on the actual Achilles tendon. So depending on what's going on will kind of depend on which way treatment options go. And there are a myriad, there's like a laundry list of treatment options for Achilles tendonitis. I'll go over a couple of them that I use here in the office that are pretty darn effective. And also remember, as I'm talking about these, Achilles tendonitis can be treated in terms of the pain more singularly with like a specific type of treatment, but overall, an overall game plan should always be developed to discuss and treat whatever else is contributing to the Achilles tendonitis itself. So, but specific treatments, I'm a big fan of regenerative medicine, as you guys well know. Those include laser therapy, which works out very, very well for acute Achilles tendonitis and pretty well also for chronic Achilles tendonitis, as well as Achilles tendon tears. Shockwave therapy works out pretty well also. I'm a big fan of that because it provides some great rapid healing and some great results pretty quickly. Both of those are non-invasive, which makes them, top of the line outside of having surgery, especially for anybody that's active and they want to get back to their sports, or anyone that might be impatient and they're willing to do more in order to either speed up the process or not have their Achilles tendon pain be prolonged. Also, there's PRP therapy, which works out tremendously well for Achilles tendonitis, especially for old Achilles tendon tears or Achilles tendinosis that's pretty chronic as well. So that's invasive in terms of having a needle. No skin is actually cut open or anything like that, but you do get a needle poke. And yes, that's something that can hurt from time to time, depending on the patient, or let me rephrase that. It kind of hurts a bit in order to get the actual procedure done, but it is well worth it, especially when we couple that with other therapies surrounding it to support it throughout the course of the healing process. So it is highly effective. So platelet-rich plasma therapy is at the top of the list. So if you can accept a little bit of pain in terms of a needle poke, then that's a good option for you as well. So those are the regenerative medicine categories that I like. There are other ones as well, such as some ultrasound type care that works out pretty decently. Also, that's mainly done in like physical therapy, lower level red light therapy, other than the laser therapy that I'm talking here in office, which is done with the class 4 machine. Is still considered low level laser therapy, but it's just a high power to it versus the handheld devices that we can have in a home setting, and it also at a different wavelength. So we also do taping and strapping. Kinesiology tape, smart tape works out well for Achilles tendonitis. Anything that we can do to take the stress load off of the Achilles, then we're in good company. So that also includes placing a person in a boot, putting a person on crutches, or even placing them into a cast sometimes if it's extreme enough. And from there, we like to use knee walkers, which also de-stress the area. It's like a little scooter that you can just ride around with. Instead of your foot being on the scooter, your knee is actually on a scooter. So it's like moved up towards your knee and everything. So many people probably seen other individuals riding around town with a knee walker or riding in their office with a knee walker. So that's pretty cool as well. And physical therapy just in general, like I said, ultrasound is also used, and other techniques can also be used, such as like cupping, hot therapy, cold therapy, even dry needling, depending on the type of Achilles tendonitis, mainly in Achilles tendinosis, where we may have had like a previous tear or the Achilles is thickened. Dry needling may be used. But dry needling and a lot that goes on with physical therapy is also highly effective for the surrounding tissues, the musculature that normally puts more stress on the actual Achilles, whether those muscles are tight and inflexible or whether those muscles themselves are damaged and can't handle their stress load, so it gets transferred over to the actual Achilles. At any rate, there are many options for Achilles tendonitis, and it is imperative for anyone who has Achilles tendon pain to actually come to the podiatrist in order to get it checked out. It's best if you're going to podiatrist or any orthopod as well that has more of a sports medicine background, because the approach is a little non-traditional, and that non-traditional approach is normally directed towards your actual way of life, which makes a huge difference when we're talking about Achilles tendonitis, because it is one of those injuries that usually persist and only worsens with time and with lack of treatment. So if you have Achilles tendonitis, come on into the office, let's get it checked out, and let's get a game plan going. And that's all I got to say for now. And until later, I'm Dr. Donald Harrison with another episode of Finally Famous. You can check out some other videos where I show laser therapy or platelet-rich plasma therapy treatment for Achilles tendonitis. I'll put some links to those videos in the description. I'll see you guys later. Bye-bye.